And included in some of the politics is a talk about Medicaid expansion and where that is going to go for our state. And joining me right now is Dr. Ora Hirsch Pescovitz. She is the CEO of the University of Michigan Health System. Thank you so much for joining me. I appreciate it.
I'm delighted to be here.
So much talk in the legislature about expanding Medicaid, and right now that's not going through. Talk to me about what an expansion would mean to people in the state of Michigan. How many people would be helped?
Well, thank you very much for asking about it. We think this is so very important, and the reason it's important is because it would help 450,000 or more of our state's citizens.
And how much would it end up costing the state? We know that through Obamacare for the next 3 years it would be covered federally.
That's right, and so it would cost the state $0 over the next 3 years because the federal government would send at least $2 billion a year during that time, and over the course of the next 10 years, the state would save at least $1 billion.
Okay, so before we talk about how much it could cost us potentially 3 years extra down the road, talk to me about the savings for the state and what that would mean in terms of having more people who are insured. Where would those cost savings come, and how would that impact, I guess, the way the state operates?
Right, so I think first of all we need to understand why we're doing this. So let's just understand that. We're going to have a healthier citizenry, the people will be healthier, and the state's pocketbook will be healthier. And so that's the reason we're doing it. So the dollars will come in from the federal government in the beginning. All of the dollars, 100% of the money will come from the federal government. Then, starting in 2020, 90% of the dollars will come from the federal government, and 10% of the money will have to come from the state of Michigan. But even then, even when some of the money has to come from the state will still save $1 billion. So it's really a no-brainer. Why wouldn't we want to do this, to have a healthier state and a healthier economy?
Okay, so we say it's a no-brainer. Why wouldn't we want to do this? But it's having a problem in Lansing. What are the lawmakers' concerns? What are they saying? What are they telling you? And what can you do to potentially change their mind?
You know, it's very difficult to understand this because I think that sometimes we make a political issue out of something that really should have bipartisan support. Sometimes we look at things like education and health care and other things that really should really be nonpartisan, and
right.
This is one of those things. There really is no reason that I can think of why this should become something that is so politicized.
And the fact that really healthcare is going to undergo a dramatic change in the next couple of years.
Absolutely.
with the new Obamacare. Tell me, in looking at the healthcare horizon, what are we in for? Is that kind of the interesting thing that we're not quite sure what it's going to look like?
Well, let's talk about what is happening to healthcare. So one of the positive things that's happened in the last few years that I don't think the public really appreciates is that there have been significant improvements in the quality of care and a decrease in the cost of care. So we've talked over the last decade that healthcare has the cost of healthcare have increased exponentially, and that is true. But if you look over the last couple of years, the rate of increase in the cost of healthcare have been declining. And that, in fact, is due to the fact that so much attention has been attributed to this. And another factor that will help is if we do provide approval of this Medicaid expansion.
You know, and it feels like it takes sometimes several years for ideas and concepts and for people to look at the research for things like that to stick. When you come up here to the Mackinac Policy Conference, what kind of conversations have you had about where healthcare is going in our state?
A lot of people are talking about this. Just like we've been talking so much about education here at the Mackinac Policy Conference, a lot of people are talking about healthcare. So I believe that if we continue this conversation, if we're diligent about it, that we will get people to understand and that this in fact will pass. It has to. We have to do this for the citizens of Michigan.
And how would that impact the U of M health system?
The U of M health system will definitely be impacted because, as you know, sequestration will take a cut out of our budget. Medicare will be cut by 2%, and so if we go forward with those cuts without the concomitant approval of insurance for people who need this, all of us at the University of Michigan Health System and all the hospitals in the state will be adversely impacted. But let me tell you something that's unique about the University of Michigan Health System that differs from the other hospitals in the state, or at least the majority of them. We also have a tripartite mission. Our mission is not only to provide clinical care to the most acutely ill patients and those with the most complex care. We also have two other components of our mission, and that is to provide education. We train doctors and postgraduate medical education, residents and fellows, but we also do cutting-edge research. And that is also very much jeopardized by sequestration. This year alone, we will lose $19.5 million due to the cuts to medical education at the level of the NIH alone. And that is devastating because medical research is going to do what is going to keep our country moving forward. We're very, very interested in medical research.
And there's so many moving parts here, and we will continue to watch this Medicaid battle unfold. Thank you so much for joining me to talk about it. I so appreciate it, and have a safe trip off the island today.
Thank you.